Hi there and welcome back. I'm Julie Musgrave. In today's health headlines, cutting out specific amino acids may help shed those unwanted pounds, according to a new study. Obese mice with a low intake of amino acids found in meat, chicken, fish, dairy products, and eggs showed improved leanness and metabolism, even though they continued eating an unhealthy, high-fat, high-sugar diet. Scientists are now looking into whether the results translate to humans and could help those at risk for diabetes, heart disease, and stroke. Former smokers may get an extra benefit from eating apples and tomatoes. Researchers found a slower decline in lung function among those who ate more than 2 tomatoes or more than 3 servings of fresh fruit each day. The study suggests those foods can help restore lung damage and slow down natural lung aging.
Carbon monoxide poisoning is a silent killer year-round, but even more so during the winter months. The Centers for Disease Control and Prevention says at least 430 people die in the U.S. from accidental carbon monoxide poisoning every year, and almost 50,000 visit the emergency room. The colorless, odorless, and tasteless gas fumes can be produced by chimneys, portable generators, stoves, lanterns, gas ranges, or by burning charcoal and wood inside the home. To protect yourself and family, change the batteries in your carbon monoxide detector every 6 months. Also, watch out for the most common symptoms of carbon monoxide poisoning. Those include headache, dizziness, weakness, nausea, vomiting, chest pain, and confusion.
Finally, there's a new quick test that helps diagnose a respiratory viral infection. It uses a simple nasal swab to then screen cells for molecules and proteins that indicate the body is fighting a virus. Researchers hope to turn the method into an easy and inexpensive test for the doctor's office. Each week, we honor a healthcare hero, someone who goes above and beyond for each of their patients. This week, we meet Leroy Ellerby. He's an example of the American dream. He started at Community Regional Medical Center in the Environmental Services Department with no high school degree. Every day, he worked hard and eventually earned his diploma. He worked 10 years cleaning operating rooms, but then was encouraged to work his way up to a sterile processing tech, where he earned all of his national certifications. Leroy says he takes pride in helping patients get better.
We are the first step in pretty much helping the doctors get their procedures done. Because if they don't have the right instruments in these sets that we put together, then that compromises the patient's health. So we are pretty much the first step of getting the patient well and off to where they need to be.
Leroy says his best advice is to believe in yourself and surround yourself with people that raise you up. Community Medical Centers is hiring.
Our job of the week is for a position in the sterile processing department at community medical centers. You must have a high school diploma or GED, experience in a medical or hospital environment, and an OR sterile processing certification. For a full list of requirements, check out jobs.communitymedical.org.
Coming up on MedWatch today, a community employee says she is alive today thanks to her coworker. And advice to manage your diabetes through a healthy diet.
Hi, I'm Dr. Gastelum. Today's health tip is to get your flu shot. Now that winter's upon us, it's a big season for flu. So make sure that your loved ones, your children, and family members all have the flu shot to protect yourselves against respiratory illnesses and things like croup that flu can cause.